Assalamu alaikum. My name is Hafiz Muhammad Hamid. My today's topic of presentation is a case study which was published in Journal of the American Veterinary Medical Association on 15 March 2018. The topic of the presentation is a Hippomane in a 6-year-old mare. Case presentation and history. A 6-year-old 500 kg multiparous thoroughbred broodmare was referred to veterinary hospital 3 days after parturition with a complaint of colic. The owner told us that the parturition had been uncomplicated. The referring veterinarian reported that the fetal membranes had been expelled in their entirety. Examination. When we performed the physical examination, the results were unremarkable, except for pale pink mucous membranes. CBC and venous blood gas analysis were within the reference limits. But when we perform the serum biochemistry analysis, it reveals that the creatine kinase and the lactate concentration level increases, but the total protein concentration level is at its low end. Early treatment and management. First, it was thought that this is a case of colic, so treatment is done according to it. IV infusion of isotonic solution at a maintenance rate of 1.5 liter per hour. Aminocaproic acid with a loading dose of 40 mg per kg is administered and mixed with 1 liter of lactated ringer solution, followed by a maintenance dose of 20 mg per kg in 1 liter of lactated ringer solution. Flunixin meglumine is given with a dose rate of 1.1 mg per kg and repeated after 12 hours of interval. When CBCV was performed after 12 hours, the PCV of the mare was dropped up to 12%. So 8 liters of whole blood is administered and the dose of the flunixin meglumine was reduced up to 0.5 mg per kg. When mare become febrile and lymphopenia and neutrophilia occurred, treatment is done with trimethoprim sulfamethoxazole with a dose rate of 30 mg per kg, and flunixin meglumine is given with a dose rate of 0.5 mg per kg intravenously. Diagnostic tools. Different diagnostic techniques were adopted to confirm the case of a mare. Transabdominal ultrasonography with a 2 to 5 MHz curvilinear probe revealed a moderate amount of peritoneal fluid containing hyperechoic particles in the ventral portion of the abdomen. Transrectal palpation revealed that the uterus is toned and horns were asymmetric, with the left uterine horn being larger than right. Transrectal ultrasonography revealed a large hematoma in the broad ligament of left uterine horn. A distinct hyperechoic multilayer elliptical structure in the uterine body was surrounded by anechoic fluid containing flocculent debris. Diagnosis. With the help of the ultrasonography, it was confirmed that this is a case of a hippomane. So the structure was manually extracted from the uterus. Further treatment is done according to it, which include uterine lavage with approximately 16 liters of dilute 1% betadine solution, which is divided into boluses of 3 to 4 liters per bolus, which were sequentially infused into the uterus and removed via siphoning until the effluent was clear. Within 12 hours of the treatment, the mare was afebrile. Outcomes. The mare was discharged from the hospital 6 days after parturition. It was recommended that the mare should not be bred for at least 90 days of parturition or until the hematoma was resolved in the uterus. The mare didn't have any reproductive issues after discharge from the hospital. After 77 days of discharge from the hospital, the mare was bred and conceived. Thank you so much for your attention. If you have any question, you may ask.